Finance and Administration. It has been discussed, as has, we have a robust tobacco cessation program.
Okay.
That's just offered locally. It's not part of our major medical program, but
Mm-hmm.
there has also been discussion at the state level. Now, the way the state put it forward, it was employee specific, not dependents, but it was centered on employees.
I was just about to ask about that. Mm-hmm.
Yeah, right now it's just a questionnaire for employees, but they posed it as if you are a tobacco user, that your costs are more. And I can readily recall, even when that announcement was made, that those of us in HR said, "Gosh, we missed an opportunity here," because it would have been a much more positive message to send if we said, "Here's the cost, but if you do not, then you get a rebate." So sounds more like, instead of punishing certain people, we're just rewarding people that are able to, you're either not using or you're able to, use the program and stop using if you are currently. So, so that was a missed opportunity.
Got it.
Something else we do that I think has been popular, and it's just been part of a slow culture change, is in our, cafeterias, having healthy choices, and then being very transparent about the nutritional value and calories of the dishes being served. That has also raised awareness of just health and wellness, gets people talking and thinking about it differently.
Right. So what's not working in the wellness programs? Anything?
Really, I think at this point, our biggest challenge is in the sort of resilience and burnout area. And I don't know if you're familiar with the national statistics of it, but the indicators for burnout and resilience, especially of healthcare workers, is a challenge.
Sure.
And so there's been much more emphasis on, not just understanding, what does our resilience look like, but how do we improve it?
Got it. So I think I'll move on to a different section now. Can you tell me about what some of the strategic goals of the university are? They don't have to be benefits related. Could be really anything.
Well, one of our largest is in eliminating the healthcare disparities in our state. And that absolutely has an implication for benefits. Our state has very high numbers of uninsured, also has high numbers of the population that are in more remote and rural areas and impoverished, and therefore their access to health care, both from a financial perspective and then just the practical, having services at the point of location where they need them, is a challenge. And we, just by legislation, we are obligated to accept patients regardless of ability to pay for the health care. And so what we see, of course, is even though we can tell people that, you will get the care that you need if you come to us, typically some of the population that I would say has more limited access to health care and are in impoverished areas, they are not getting good preventive health care. And so by the time we do see them, they typically have some fairly debilitating diseases and conditions that are, of course, not, they're more costly. They inhibit their quality of life. And so it's a self-perpetuating issue. So one of the biggest efforts is in partnering with others in the state so that we can identify how to get health care to people where they need it, and in a way that it's not just delivering disease-specific care once something's wrong, but how do we change the culture with a focus on prevention,
right,
and teaching people
sure,
how to make healthy choices. Like one of the things that one of our schools does that I just think is the most impressive is going out to rural communities and teaching them how to plant and garden their own fruits and vegetables.
Okay.
So it just, it's a really neat idea.
Right. I agree.
We have in really every school, there are pretty large efforts to do community-based, screenings and services on, like a Saturday. A few months ago, our Cancer Institute had a free breast cancer screening in which, you could come in and have your screening and your mammogram and have it read in the consult done all in the one day. Just as, and it free of cost, free screening in order, just to get an emphasis on how important it is to get yourself checked and catch any issues early.
Right.
We do the same kinds of things in our dental school. Our School of Nursing has a mobile that they take out.
Sure.
So instead of people coming to us, we go to them.
Right. Mobile mammogram. I've seen similar things. What other strategic goals? Is there anything else that, is really kind of top of mind for the university?
The other, that it does have a benefits component to it in the sense that people are coming to us for their medical care, but one of our other largest strategic initiatives is around quality and safety metrics of the healthcare that we're delivering.
Okay.
So, and it's really, emphasizing a culture of reporting opportunities for improvement, of being candid about near misses, places where we have process gaps that could lead to, less quality of care because we have gaps in a process that might make it more likely for human error.
Right.
And
what about what about
that initiative is really led by our medical staff office.
Okay, that makes sense. What about any current issues that your university is facing?
Certainly one of the bigger issues, and it's really for all healthcare institutions, is a shift in, instead of paying a patient paying for a particular service at a certain charge, that it's a value-based pay. So the better your safety and quality metrics are, the more the institution, the healthcare organization is incentivized and supplemented from government plans. So, for instance, your metrics around readmission of patients and hospital acquired infections, things like that we're going to see over the course of the next few years. Those are going to be the drivers then of what the healthcare organization is able to collect in terms of revenues and what they'll be able to charge. And so it makes some of those preventive measures that we put in place, like, hand washing, even more important.
Sure.
So.
Sure. Yeah, there's a whole other level of things you need to consider when there's a hospital component, right?
Absolutely. Now, as far as the other mission areas, certainly challenges with an institution such as ours that has a very large support from extramural funds. And so when we see fluctuations at the at the federal level, shrinking NIH dollars, then we see that show up, of course, in, our researchers' ability to get extramural funding to continue with their lines of research. And we've continued